Hello, today I'm going to discuss with you about febrile seizure. I think fever with feet is very common but is very scary. So I today will be discussing some part of it. I think I have to continue because a little bit of discussion is there. I don't want to continue forever. So first of all, I will tell you about febrile seizure. That is a fit that can happen when child has a fever. Now, febrile seizure, sometimes also called febrile convulsion, and it's very common. And most of the cases they are not serious. And around 1 in 20 child will have at least one febrile seizure at some point, and mostly it occurs between age of 6 months to 3 years. During febrile seizure, child's body usually become very stiff. They lost their consciousness, their arms and leg they twitch. Some children may wet themselves, and this is called tonic-clonic seizure. Now, what to do during seizure? If child have the febrile seizure, place them in recovery position, means lie them on their side on a soft surface and their face turned to one side. This will stop them swallowing the vomit and keep their airway open and help them to prevent injury. Stay with your child and try to make a note how long seizure lasts. If your child's first seizure and it lasts longer than 5 minutes, take them to a nearest hospital as soon as possible or dial 999 for an ambulance in UK. While it is unlikely that there is anything seriously wrong, it's better to be sure. If your child had febrile seizure before and seizure lasts for less than 5 minutes, then you can call your GP or NNH 2411 service in UK for advice. Don't put anything including medication, if your child's mouth during a seizure, because there is a slight chance they may bite their tongue actually during the seizure. Almost all child make a complete recovery after having a febrile seizure. However, we have to know there are different categories of this type of seizure. So main two type, one is simple one, that is the most common one, and 8 out of 10 cases, that is tonic-clonic I mentioned, and last for less than 15 minutes and does not occur within 24 hours or the period in which your child has an illness. Then another type, that is a complex febrile seizure, that is a less common type, accounting for 2 out of 10 cases. That complex seizure is any seizure which have one or more of the following feature. First of all, seizure will last longer than 15 minutes and your child only has symptoms in one part of their body, that is called partial or focal seizure, and your child has another seizure within 24 hours of first seizure or during the same period of illness, and your child does not fully recover from the seizure within 1 hour. So these are all which is not very simple. Now, why the febrile seizure occurs, we don't know. Although they are linked to start of a fever, higher temperature of 38 degrees centigrade or 100.4 degree Fahrenheit or above, that can be there is underlying any infection like chickenpox, like flu, like middle ear infection, tonsillitis. They are also genetic link to febrile seizure because chance of having seizure increase if the close family member has history of them. Around 1 in 4 child affected by febrile seizure if they have family history of this condition. Now, about complication, febrile seizure increased linked with, with increased risk of epilepsy as well as other problem. Research recently indicate a link between febrile seizure and sudden unexplained death in childhood, possibly due to connection between febrile seizure and epilepsy. However, a link has not been proven. It is incredibly rare, and sudden infant death at around 1 in 100,000 children. So it's very little chance. In addition, one of the biggest study of kind looked at more than 1.5 million children with history of febrile seizure and found no evidence of increased risk of death in later childhood or adulthood. Now, there is a big questions always comes that many parents will be worried whether the child has one or more febrile seizure and they will develop epilepsy when they get older. Epilepsy is a condition when person has repeated seizure without fever. It's true that children who had a history of febrile seizure have an increased risk of developing epilepsy. It should not be stressed, and the risk is still small. It is estimated that child with history of simple febrile seizure have a 1 in 50 chance of developing epilepsy in later life, and children with history of complex seizure, febrile seizure, 1 in 20 chance of developing epilepsy in later life. So this is compared to around 1 in 100 chance of people who have not had any febrile convulsion or seizure. So that's our nutshell. We'll talk about that. So we will next time we'll tell about the symptoms and cause of the febrile seizure in a bit. Bye bye for today. Hope it will help you as a carer and parent.